Welcome to today's session on understanding the IUI process by Apollo Fertility. To speak on the topic, we would like to welcome Dr. Nikita CP, who is our in-house consultant of OBG fertility and laparoscopy. She has done her MBBS, MS, FMS, and FRM. We welcome you, Doctor. You can now take over the session. Thank you.
Yeah. Good afternoon, everyone. I'm Dr. Nikita from Apollo CM Fertility. So today I will be talking about IUI. Okay, so to start off with, basically to define IUI, it is the direct transfer of processed semen into the uterine cavity at the time of ovulation. So ovulation, it depends. Each women have a different ovulation window. It's usually considered in a regular cycle around 14th to the 16th day. Okay, so the rationale for IUI, basically why do we do IUI is to get the maximum number of sperms at the fertilization site. Okay, and also to bypass the cervical factor in any cervical mucus incompetence and everything. So it's better to it bypasses the cervical factor. Then the next thing to go on, we'll look at the indications for IUI. So indications for IUI, basically there are two things. One is with husband semen sample and one more is with the donor sample. So with the husband semen sample, there are some certain factors. Usually the female factors that affect, the indications for IUI are any anatomic defects in the cervix or the vagina, and any sexual dysfunctions like if she has vaginismus, or any other like anovulatory cycles in cases of endometriosis, etc. In the males, we would normally consider mild cases of any semen abnormalities like oligozoospermia, astenoteratozoospermia, and stuff. And also some anatomic defects in the male like hypospadias, and also few more sexual dysfunctions like ejaculatory erectile dysfunction. Then to go on to the then also with the donor insemination that is usually done, the indications for donor is again if there is any sexual dysfunction, or if the IUI is done for 6 times in the with the husband's semen sample and it is failed. Then the next thing is any case of unexplained infertility. So unexplained infertility is one of the most, say around 15 to 20% walk in with unexplained infertility. Some of the contraindications for IUI are, um, it is in case in female factors, it can be cervicitis or cervical atresia, and in the males, it can be because of any in the and also in females about the tubal block, that is a bilateral tubal block, and endometriosis is one of the major causes. Okay, and in case of males it can be because of then in evaluation, under the evaluation for IUI, you have the female evaluation and the male evaluation. So for the female evaluation, first baseline investigations that are done is a transvaginal scan to see the antral follicle count, and also the ovarian volume. And the next investigation will be HSG. HSGs are done to see the tubal patency. And and the next thing is the blood test. So basic hormone tests like estrogen, progesterone, then the FSH values, LH. Then in case of PCOD, we'll have to do fasting insulin levels, and also the glucose tolerance test. And more than 35 years of age, we will be doing an AMH levels, that is the ovarian reserve levels. So in a normal ovarian reserve for in the reproductive age is around 2 to 6. Anything less than 2, then we have to treat the couple. Then under the male factors, under the male investigations, we will be doing the husband semen analysis. So we have to in the analysis we have to look at the concentration of the sperm, the motility, as well as the morphology of the sperm. So any of these factors, if there is any deficiency, then we prefer IUI. And the next thing is check in the male, you'll have to do if they have any other complications like varicocele and stuff, then you will have to do a Doppler study. So now, can I take some questions in between? How does a woman need to prepare for IUI process? Okay, so for prepare of IUI process, see, so basically the steps of IUI basically will be the women will have to come to the clinic around the second day of cycle. So we start off with stimulating the patient from the third day of periods. Okay, we give them usually electrodes, give them for 5 days, and then call them for a scan from the ninth or the 10th day of period. So from there we see the follicular development and also the endometrial thickness. So once the follicular develops to up to 18 to 20 mm, and also the endometrial thickness is more than 8 mm, then we give a trigger. Usually it is HCG if the follicles are less than four follicles. So we give a HCG trigger, and around 36 hours later, we do the IUI. So IUI basically we again confirm it with scan whether the follicle is ruptured, and then process start with the IUI procedure. So it is a basic OPD procedure. It is a simple procedure, and does not need much. After the so the procedure is basically they place a small catheter inside the uterus and pass the semen sample, a process semen sample which has a good concentration of sperm and good concentration as well as the good motility sperms are placed inside the catheter and inseminated, and the patient is asked to lie down for around half an hour, and then she can get back to her routine activities. Okay, so how successful is IUI on first try? So about the success of IUI overall, we say around 20 to 30%. But usually, in a couple the IUI success rate in first two cycles is only around 71%, around 85% in the first four cycles. So most of them do conceive in the first two cycles. Is a IUI healthy baby? Yeah, IUI procedure is nothing but almost like a natural cycle. Only thing is that we are processing the semen and placing the good sperms inside the uterus. So about the health of the baby, it is not affected. Is IUI is a cost effective option? Okay, yeah, definitely. In patients who cannot afford IVF and who are waiting for IVF, in that meantime you can do IUI because the cost is not as much as IVF, of course, so it is definitely cost effective. Okay, what are the disadvantages of IUI health wise post treatment? So, in cases where there is a male factor infertility in severe oligozoospermia and cases like that, the disadvantage is that they will need many cycles. So, in that, when you have to do around six to say six cycles, then the cost adds up. Where in IVF, the success rate will be better in those cases. Is IUI better than natural? See, IUI better than natural? Not really. In any natural conception, we try for about 3 to 4 sessions. If it still doesn't happen, then the next step is to go for IUI or whatever indications are given. Those are also considered. But apart from that, if 3 sessions of natural cycle it's not working out, then there is some unexplained infertility. So in those cases, we do go in for IUI. Okay, would you suggest IUI is safe or IVF? See, IUI is safer than IVF, definitely, because in IVF, what happens? We give highly purified injections starting from second day, and that cause their targets on almost all the follicles that we see on the second day doing the antral follicle count. So when we target all the follicles, the growth of most of the follicles grow with the highly purified injections, and those lead to risk of ovarian hyperstimulation syndrome. So definitely, IU in IVF is more risky than IUI. Okay, so to tell you a little more about it, about the process. So I think I got into the steps also. So any other other questions? So to conclude with IUI, basically IUI is a safe procedure. It is inexpensive, and also IUI is a good mode of treatment in cases where patients are waiting for IVF at least. Okay, so yeah.